Welcome back, everyone, from your break. And if you're just joining us, welcome to session 3, which is AML. Couple of notes before we get started. We want to thank you again for attending the 2020 Virtual Lymphoma, Leukemia, and Myeloma Congress. This is day 1 on acute leukemia and myeloid malignancies. Before we get started with this session, I want to let you know that we have launched the pre-activity survey questions on the polling tab next to the live stream feed. Please answer these 3 questions by scrolling down the tab and clicking submit after each selection. These data will be used to determine how effective this CME activity was, as well as to assist with the development of future CME activities. Social media. We invite you to please interact with us on social media. Our Twitter, Facebook handle is @LLM Congress, and remember to tag your posts with hashtag LLM Congress 2020 Virtual. So to introduce this session, which is AML, we're going to have talks presented on several topics. We're going to have venetoclax-based strategies in AML by Pinkel Desai. I'm going to talk about post-remission strategies in AML, and then I'm going to debate my colleague, Chris Hurrigan from the NIH. I am talking about AML patients with MRD positive remission should undergo allotransplant, and he is saying that patients with MRD positive remission should not undergo allogeneic transplant. Sasha Pearl from Penn is going to talk about FLT3 mutations in AML. And then we're going to have a case discussion with all of us. So I will be there, Dr. Pearl, Desai, Lee, and Ellen Ritchie will join us again. And I'm going to throw out lots of different variations on a theme of trying to cover many different new options for AML therapy in the context of a case. As a reminder, you can submit your questions on the Q&A tab throughout the session. In addition to liking somebody else's question, if you want to see that get answered, please only submit questions that are related to this session. And at the end of the session, my panelists and I will host a question and answer period during which we'll get to all of these questions and also have another look at the polling questions, which you're answering hopefully now. In order to submit and see questions in polling, please do not use the full screen mode. And if you're experiencing technical difficulties, please use the help desk chat or contact us features on the website so that we can assist you. For CME credits, please click on the accreditation tab in the virtual site for more details on how to complete the meeting evaluation and obtain your certificates. So we will break at 2:35 to allow you to go to the virtual exhibit hall and earn points by interacting with sponsors and attending specific sessions for our Engage at LLNM competition. And see that page, Engage at LLNM, for the official rules and how to enter. You can visit the virtual abstracts to view 40+ abstracts, including our 2020 award winners, and attend the Innovation Theater, which starts at 2:40, presented by Bristol Myers Squibb with James McCluskey, who will be speaking about a new treatment option for patients with AML, cryptic title. So without further delay, we would like to begin the first presentation of the session. It is my pleasure to welcome Pinkel Desai to talk to us about venetoclax-based strategies in AML.